Hey everybody, this is Dr. Rudy. I'm so excited. I'm here with the amazing Jay Campbell. Again, this is who helped me get into this path, and I look up to him so much. And
Thanks, Doc.
I'm lucky to be here today and to try to pick his brain. So again, Jay, welcome to Miami. Thank you for being here with us.
Thank you, Doc.
So first thing I wanted to find out from you, how did you get into this? Especially back then when not many people were doing it.
So as I always say, there are no coincidences, only synchronicities in the universe. At 29, I was kicked in the testicles playing basketball in an adult men's league. And about 8 to 10 weeks later, I started feeling horrible. My lower back was killing me. I went to my primary care doctor. Again, not a coincidence, but a synchronicity. He recommended me to an endocrinologist who tested my blood testosterone levels, found out that I had, I'm going from memory now, obviously this is years ago, but probably like a 260, 275 or something like that. He said, hey, look, you have the testosterone levels of a geriatric male. I can absolutely bring you back with testosterone and HCG and go home, talk to your wife and ask her if she would be on board with that. So again, I was almost 30. It was in January of, I think it was, let's see how old I am now. I think it was 1999. Mm-hmm. And she was like, hey, you're a smart guy. I believe that you'll be okay. So anyway, went next day, told him sure enough. And then, I started doing 2 shots of therapeutic testosterone a week with HCG. And as he said, in 8 weeks, I started to feel amazing. So, I had my appointment with him. I came in, he's like, okay, well, I'll take you off. And I literally looked at him and said, you're not taking me off. Are you kidding me? I mean, I've never felt this good in my life. So from that point forward, I just became this voracious student. I poured through PubMed, I surfed Medline, and then I read every book I could get my hands on. I always give credit to Nelson Virgil because him and Dr. Michael Mooney wrote the book Built to Survive. Mm-hmm. And they were looking at AIDS patients who were literally given a death sentence. And so they, understood how to use therapeutic testosterone and all these other different agents to, keep themselves alive. So, his research, I read everything, Rudy, Doc, that I could get my hands on that would allow me to truly, as I say, biohack my way into understanding how to use therapeutic hormones to optimize my physical health.
That's amazing. And I give you so much credit because back in 1999, it was a wild west. Nobody knew what we were doing.
Nothing.
But one thing I want to ask you, try to think pre-optimization. So you came up with this. There's pre and post-optimization. What kind of man were you after you got hit in the balls and you had low T? How are you relating to your peers at work with your partner at that time?
I felt worse I've ever felt in my life. I mean, I literally thought that I could never play basketball again because I had debilitating low back pain, right? And then, it also manifested as like a lack of energy. I went into a very dark point. Yeah. It was a short term, thankfully, but I really, when I went to the doctor, because I don't go to the doctor unless it's mandatory, I was like, yeah, right? I'm like, something's not right, Doc. And again, I remember the guy, it was plain as day, he didn't have a clue, but he was like, you know what? You're too young and healthy. I'm just going to recommend you to this guy because I know him. Yeah. And again, the rest is history, but I felt so amazing, like I said, about 8 to 10 weeks. It was everything he said that was going to happen. And again, there was no point in my mind of coming off because I'm going to biohack myself to the place where I'll even make this better.
So, the butterfly effect, right? So one little thing that happens, let's go back in time and imagine. Let's say you got that trauma, you got low T, and you never got treated for it. Where would you be today?
Not here, that's for sure.
Completely. And do you know how many young men we have who are having those symptoms and cannot find the right help?
I mean, it's an epidemic.
It's an epidemic. So I think, see, we're doing all this for awareness. And that's why me and you, we get along so well, is because we have a desire to help people.
Right.
We're healers.
Right.
At the end of the day, we're healers.
Right.
So there's a great Einstein quote that really inspired me. And it says, those who have the privilege to know have the duty to act.
Right.
I didn't know before. When I started practice, I did not know that we could help patients like this. I was fortunate enough that I got extra education. I got certified in hormone management, knowing how to use testosterone, despite what I learned. And that's what got me into that position. And I know both me and you, we hear that call. We need to let other people know, not only physicians, but patients. We need to bring hope to, again, think about you. If you didn't get treated, where would you be?
Yeah, can't imagine.
And there's thousands, if not millions of men, young men that this is happening to and find no help. And this is a good way that I wanted, a lot of the conversation I wanted to have with you was the effect of the toxins that are around us are creating a generation of guys who have hormonal deficiency, hormonal imbalance. With that hormonal imbalance, our society is suffering because men cannot rise to be the best men that they can be. So we need to be here to try to raise awareness. We can't treat everybody, but we can raise awareness.
Yeah, I mean, if we talk about that, you know, and I'm obviously, as you know, I've interviewed the great Dr. Anthony Jay, the Mayo Clinic's, you know, researcher, no longer affiliated with the Mayo Clinic, but still doing amazing work, talking about what he calls, his landmark book was called Estrogeneration, but essentially the contamination of the environment through EDCs, which are endocrine disrupting chemicals, right? So again, we've talked about the endocrine system and how important that is to regulate, you know, all models of health, but there's no way, Doc, that anyone can escape the modernization of today's environment, right? Like Dr. J talks about anywhere now in North America, if you put a freshwater male fish into any stream, tributary, lake, aqueduct, even saltwater bodies, within 1 year, they are now they become female. So if you extrapolate that data and you look at across the board, you know, male and female, you know, physiology, you know, in North America, and I would say this is more globally now, but just to focus on North America, you see it in the patternization or the male, you know, the estrogeneration, however you want to call it, of like female fat patterning. You know, you look behind from looking at large swaths of males in the population, if you're like in a large open outdoor center, and you will see, again, higher levels of female body fat patterning, right? So you're seeing this, what we would call demasculinization of men. And again, this is all chemical. This is from all of these agents. It's from this endocrine, you know, disrupting onslaught of chemicals and particulates. And so you and I have to do a better job as he is doing and letting this community, you know, both patients and clinicians, to understand that this is a problem that most men, as you already said before, can't do anything about. This is it, whether it's in utero or it's whether just their environment that they're so contaminated, you know, they have to become aware to this because as you've already said, like awareness is the greatest issue.
Completely. And the more research I've done about this, and I've read Dr. J's book, Estrogeneration, and it's amazing.
Sure book.
The research is amazing. And my book is going to be called Low T Generation, because we have a generation of men growing up with low T.
Right.
And again, because of the estrogeneration that we have. But the one thing that's scary when we talk about this is no matter how careful you are, you can never be completely free of those chemicals.
No.
So right now, we are in the midst of a crazy experiment where they are throwing millions of tons of chemicals that are, some of them are proven to be harmful, most of them there's no studies on them, and then we're just throwing it in the environment and let's see what happens. We're seeing what happens.
Right.
You know, EDCs, it's not just related to sexual problems, testosterone. Dr. Shanna Swan, who did her book Countdown, she linked it very clearly to fertility, and fertility issues are rampant.
Yeah.
But there's another great book, Obesogen Effect, that it shows that the EDCs are causing, or not causing, are a major contributor to our obesity epidemic.
Absolutely.
So once you put EDCs into the equation, it's not calories in minus calories out.
That's exactly right.
So it changes.
It's very important to understand that. And again, Dr. J, in his credit, Swan, they talk about people in the Midwest who are being bombarded with atrazine and glyphosate, right? From the runoff from the fertilizer that is going to the crops. And so these people who are obese, it's not a matter, as you said, of counting calories or exercise or anything like that. They literally have these endocrine disrupting chemicals in the triglycerol and the triglyceride of their, as you talked about earlier too, of their internal body fat. And these things are sitting, these chemicals are sitting in the edges of that body fat, and they cannot rid themselves through normal means of exercise and caloric restriction. So this is a serious issue. And as you said, it's not being talked about. It's definitely not being studied. I would even argue that there's probably, you know, at some level of the EPA and the environmental agencies that are looking at this, they're probably just covering this up, because if mankind humanity found out about how bad of this it would be kind of a really cause for concern.
I agree 100%. So personal story about this. I went to Hawaii maybe 10 years ago. And there's the beaches, when you go there, they actually look at what sunscreen you have on.
Right.
You cannot use regular sunscreen. And I said, why? They're like, well, it's killing the coral.
Exactly.
So I didn't understand. I was like, oh, well, I did a little research and it shows that it's bleaching the corals. I'm like, oh, okay, I understand. But again, in Estrogeneration and in Shanna Swan book, they tell you this. It's not just that it's killing the corals. It's actually affecting the fish that is building the corals, and it's making those fish infertile.
Exactly.
So they can no longer reproduce, so there's less fish. So my thinking was, oh, I cannot put that sunscreen on because it's gonna make the fish infertile. What about me?
Right, exactly.
I'm putting that sunscreen every day. Everybody, and we found out. So now we even know the name of the chemicals. Dr. Jay again wrote that anything with oxy, anything with fen, anything with benz, turn your bottle. If you see those chemicals in there, throw it away.
Yeah.
Protect yourself.
I mean, Doc, almost everything that's in our kitchens and our baths has these chemical agents in it. And people do not know, and again, to give credit to Dr. Jay, one of the first things that people can do, and again, no one's doing this, is put a filtration system on your shower. Because think of the impurities that are coming through the water. I mean, again, if you live in a large city or coastal population center, or really just urban center, the water supplies are contaminated, again, from the leaching of where these chemical agents are going. As you know, and we didn't mention this, and we should, and Dr. J does a great job of this, but birth control in the water supply.
Yeah.
Think of all the women that took birth control 30 and 40 years ago who then, just did what they normally do, and it washed off into the water supply. And now we have, all of this sexual confusion, identity issues. I mean, I don't even want to go into that, but this is all biological, and it's from the modernization of society.
Yeah, so this needs to be talked about. There was a great documentary on Netflix, A Plastic Ocean.
Yep.
It's great.
The giant blob that's floating in
but
the Pacific.
They're talking mostly about how plastic affects fish and wildlife.
Biodiversity.
There was maybe 5 minutes on how it affects humans.
Of course.
We need to talk about us.
Of course.
We're being killed by those chemicals. Let's talk about it. Let's raise awareness. But I'm not the doom and gloom, I'm the eternal optimist.
Yeah, absolutely.
So this sounds bad, but we know how to help people. If you find yourself in that situation, look at you.
It's hormonal optimization.
It's hormonal optimization.
Let's just be honest. The bottom line is all of this, the biggest tool in the tool belt is using therapeutic hormones, and we can intervene with any situation in any crisis, whether you are 20-year-old contaminated from blue light, you have serotonergic and dopaminergic pathways that are screwed up because of the blue light. All of this can be fixed. Seeing someone like you who can write them a prescription for, not just again therapeutic hormones, but other agents. We know how to solve this. It's just, as you said, it's mass awareness, and it's getting more people involved so that we can solve this again across the world.
Exactly. And we always like the positive note. So yes, it is scary. It's a scary world out there. But what I want for our viewers is educate yourself, empower yourself, and find the right team that can help you.
Beautiful. Thank you, Doc.
Thank you so much.